How are you doing today? My name is Isabel Sendra. I'm a nursing student at USM. Can I please confirm your name and date of birth? Okay, Mr. Lopez, can you also tell me if you have any allergies, especially latex allergies, before we begin this procedure? All right, awesome. Okay, so the doctor ordered me to perform a nasogastric insertion. I will be inserting a nasogastric tube into your nose and then through your pharynx and into your stomach to administer fluids and nutrients because the doctor has noticed that you are not intaking the right amount of nutrients and fluids, so he has ordered me to put a nasogastric tube into you. The process should not be painful and you may have some discomfort. And please do let me know if you experience any choking, inability to breathe, gasping, cyanosis, or vomiting. So, okay, I will be putting on some hand sanitizer and then putting on some gloves. I will be moving the bed into the high Fowler's position. I'll also be placing this pad on you in case there is any spit or liquids that come up. And I will give you this enema basin in case you do have to vomit or spit. And first, before we begin, I will be measuring the nasogastric tube to make sure that when we do place it, that is, remains in this correct placement and doesn't move too far up or too low. And I will be measuring it from the tip of your nose to your earlobe and then to your xiphoid process. And I will be marking that off with a bit of tape. Before we begin, I will be inserting the nasogastric tube 2 to 4 inches into a lubricant. So let me go and do that. And then also I will ask you, Mr. Lopez, when I do insert the nasogastric tube into your nose, I do ask that you put your head back and that you breathe in. And I will check both of your nose to make sure that we have clear passage. So I'm checking this one, I'm checking this one. And I will ask that you breathe in and tell me which nose you can breathe in better. Alright, so you said the right one. Alright. And I will insert it on the count of 3. So just make sure to tilt your head back before we begin the procedure, and don't worry, you may have some discomfort, but it will overall not be painful, but I will stop it in case you do have any choking, inability to breathe, cyanosis, or anything such as that. Okay, 1, 2, 3. All right, so tilt your head back. And then once we see that it is in the pharynx, and I'll check the mouth and make sure that it is not coiled up, I will ask that you tilt your head forward, chin to chest, and I will insert it further into your esophagus, pharynx. Alright, so I'm checking, I don't see it coiled, so I will ask that you tilt your head forward. And then you can also take sips of water while I insert it so that it will be more or less painful. Alright, so I think it is in the correct placement. Alright, so now I will tape it to your nostril so that the placement isn't off or anything. So let me get my pads. All right. So I will wrap this around. And then I will also tape it onto your hospital gown as well. To make sure that the placement does not move. All right. Mr. Lopez, how are you feeling? Please tell me if you feel any discomfort or pain. All right. So there is a wire in that, and before we can start feeding you and you can start using the nasogastric tube, we must take you to x-ray to confirm the placement of the nasogastric tube. And once we do confirm the placement, we will take the wire out and we will begin to feed you nutrients through the nasogastric tube. All right, I will check up on you in a few hours to see how everything went. All right, thank you, Mr. Lopez. You have a good day. All right, goodbye, Mr. Lopez. Mr. Lopez, how are you doing? My name is Isabel Sandra. I'm a nursing student at USM. Can I please confirm your name and date of birth? All right, Mr. Lopez, do you have any confirmed allergies? All right, you do not? All right, sounds good. Well, today what I am going to do is the doctor has ordered me to remove your nasogastric tube. You've gotten all the nutrients that you do need. So before I begin this procedure, I will wash my hands and then apply some gloves. I will also place this pad on you in case there is any liquids that do come up during the procedure. While I'm removing your nasogastric tube, I will have this in case you do need to vomit or spit up anything. So let me remove the tape. I remove the tape here as well. And this is all after x-ray confirmed the placement and they took out the wire and started feeding you for a few days, and the doctor realized you do not need this anymore because you received all the necessary nutrients. All right, okay, so I will ask that you tilt your head back and I will give you some water in case you do need it. And I would like that you, on the count of 3, that you hold your breath while I remove the nasogastric tube. So, on the count of 3, 1, 2, 3. Taking deep breaths, Mr. Lopez. And slowly remove it. All right, it came out. I will move this into here, wrap this up. All right, Mr. Lopez, how are you feeling? Feeling good? Awesome. All right, Mr. Lopez, now that this is removed, I will go and document all my findings. I will document the visit. I will document how you're feeling, your symptoms, signs, and I will also go and report all of this to the doctor, since he is, and he also will tell him how I followed his orders. All right, I'll remove my gloves. All right, you have a good day, Mr. Lopez.